I am Paula Moreno. I'm a psychiatrist here in Spain. I've been working as a psychiatrist for around 14 years now. I work with clients that need help either with addictions or mental health issues, or both, which is many times quite often to have them together. So I decided to focus on addiction and learn more about addiction because I could see that many times it would come together, mental health issues and addiction, either one before the other or the other way around, sometimes all together. And if you just focus on one of them too, it's never gonna work well. You need to do them both, actually. It's called dual pathology. And this is why I decided to do this. So my experience with different types of addictions is that no matter what type of addiction it is, could be behavioral, could be substance abuse, they all share different things. And so for instance, it's sometimes many times, if not all of the time, they are covering something, right? So it could be that they are seeking for to deal with some problem or some issue that they have, or sometimes it's part of the mental disorder that makes them have this behavioral or substance use. And so it's very difficult to actually separate them completely, and you cannot just treat one thing without dealing with the other if you want to do things right. My approach with clients is to see them as individuals, right? Because even though the substance use could be the same, each people is different. They come from different environments, they have different issues, and you cannot treat them all like the same, which is why I like this place, because this place adapts a lot to what each individual needs, and we adapt depending on that. So when I see them, I make like a general evaluation, both from the medical and psychiatric perspective. And then we, together as a team, we coordinate to see, okay, what does this person need? What can we do for this person? And then we work together as a team. This adds a lot of value in treating the client or the patient. When someone is struggling with a mental health issue, sometimes they feel like nobody can help them. Nobody's going to understand them, and there's no point in going anywhere because they don't know me, they're not going to understand it, they're not going to be able to help me because they feel this despair or sometimes shame, when the reality is that, of course, we're not in your head. We cannot exactly understand everything, every thought process that you have, but we have a lot of experience in helping people with the same issue that may have been undergoing the same problem. And so what we do is, it's not, when people think about a psychiatrist, they just think medication. It's not just that. Obviously, medication can be part of the treatment plan, but it's not all about that. It's also about having psychotherapy and making your day better by eating healthier, doing exercise, meditation, many different things that all together with a proper plan that is individualized, the patient can get better. And so I guess my message would be not to lose hope and to seek for help nevertheless, because when you're in such a bad place, I guess the question would be, what do you have to lose, right? Give it a try, and that's what I would say.